Having a gut feeling is a term thrown around regularly, but is there more to it than we think? Gut issues are common, and half our population suffers from a digestive problem in any 12-month period. From simple digestive disorders all the way to bowel cancer that affects 1 in 20 Australians. But what about the gut's connection to our brain and the term microbiome, sometimes described as our second brain? Could it play a significant part in our moods and mental health? Well, we sent Brodie Young out to discover what people and their guts think about this complex topic.
Do you think your gut and your brain are somehow connected? Obviously they are.
Yes, they are. Yep.
In what way?
What happens here happens there.
Or the other way around?
If you're stressed, I reckon it has an effect.
So as someone that actually suffers from mental health, so I have bipolar disorder and also adult ADHD.
Yep.
Since I've changed my diet and my gut health, my mental health has improved probably, I'd say 98%.
Yeah, probiotics. Yes, I take one of them every day.
Yeah, I can't judge my wind passing on the rest of the population and what they do. But yeah, you certainly, you'll have certain meals, but that could be just like eating vegetables can suddenly give you that.
Like last year, I did an experiment by myself where I cut sugar, coffee, and alcohol for 2 months, and you can feel a difference indeed.
Well, look, in terms of gut health, there's so many more products out there that never used to exist. Like things like kefir have become popular recently, as well as the traditional yogurt and stuff like that. Kombucha.
Kiwis with the skin on.
Really? The fur?
Yeah, kiwi with the skin on works every time.
That is a good tip. I thought I was the only one eating the whole kiwi fruit. It's so much neater that way. Keeps it all in the same spot.
You don't peel the kiwi fruit?
Well, get all India. It's great. It's nature's little packaging. Interesting cross-section of opinions, though, that Brodie Young heard when we took to the streets talking about gut health. And although we don't necessarily like talking about it, particularly the noises our gut can make, perhaps we should.
I'm sorry, it's not my fault.
Blame
it's
the
very
dog.
embarrassing. But there's good reason to pay attention to the noises and other signals our insides are sending us. According to the Gut Foundation Australia, bowel cancer affects about 1 in 20 people in this country, which leads us to the big question, why is the health of our gut so important?
Yeah, let's make it a big topic for discussion today. Our panel of experts include Naturopath Dr David Jivan. We have Dr Amy Gajjar as well, Integrative GP. GQ is with us as well. I mean, Doc, how do we know that our gut is actually healthy? Straight up.
So many people may actually have gut symptoms. So that could be something like bloating, gas, constipation, diarrhea, irregular bowel habit, maybe some food cravings, maybe nausea, vomiting. They might find that they're intolerant to certain foods. However, the important thing is, especially from a lot of the recent research now, is that people can have gut issues even though they may not have gut symptoms.
Right.
So, for example, children's learning and behavioural issues like autism, ADHD,
Really?
autoimmune conditions, again, that's by virtue of the fact that most of the immune system resides in the gut.
Yeah.
So these days, with a lot of chronic illness that we're seeing today, we always have to look at the gut, whether they have symptoms or not.
Right, I've been very interested in the link between the gut and mental health, David.
Yeah.
How does this work? I'm amazed by it.
Well, first of all, a developed adult brain weighs between 1.3 and 1.4 kilograms. And they reckon there's about a kilogram of bacteria in our body, most of it in our gut. But yet, that 1 kilogram of bacteria is clinically considered to be more sophisticated in genomes and biochemical pathways than your brain.
No way.
Yeah, but then there was another discovery of this pathway called the gut-brain axis. Now, fundamentally, it's this bidirectional network where the gut and the brain basically talk to each other.
Amazing.
Right? And they've now discovered probiotics that actually can assist with anxiety, depression. And there's even 3 of them they've actually found. From memory, there was Acidophilus, Bulgarum, and also Cassie, which have been actually shown to decrease what we call the depression score in people with MDD. So in the future, what we're going to have is things like psychobiotic treatments for mental health.
I mean,
phenomenal stuff.
The correlation between our diet and therefore our happiness and mental health is quite strong. There's more happiness receptors in our gut than our brain, are there not?
I'm a little blown away by how complicated we make gut function. I know we're all in the industry, but essentially, when you eat something, it either your tummy's happy with or it's not happy with. When you take a medication, your tummy either tolerates it or it doesn't. And we just need to, I think, reduce the complicated stuff where it is so complicated now to really enjoy what we should be enjoying.
What about, away from diet, the effects of stress, say, from our work life, our environment, on our gut health? Dr. Amy.
There is now so much evidence that stress affects our gut, and the World Health Organization have actually deemed stress to be the 21st century epidemic. So it's something that we all have to address. So aside from our mental, emotional stress from day-to-day life, work and personal, stress to our system also is about having the wrong foods, not having enough sleep, having too much or too little exercise, exposure to environmental toxins. Stress causes leaky gut, which underpins a lot of the chronic illnesses that we're seeing today.
What is leaky gut?
So leaky gut is basically where the barrier between two cells that are next to each other in the gut, that gap widens a lot more than it should. What that means is twofold. First of all, it means that toxins that are meant to be excreted from the gut, from the blood, can re-enter the blood, and toxins can circulate anywhere through the bloodstream and affect the brain, any other organ at all. It also means that nutrients that are meant to be absorbed into the blood can get lost out through that leaky gut as well. So often you actually see clinically low iron and low other sort of B12 and zinc deficiencies, not because people aren't eating the right things, but it's not getting absorbed and it's just being lost.
All of that due to stress?
Absolutely.
Amazing.
Yeah.
So what can we do about it? We know that we're supposed to eat better and exercise and sleep better, but that's easier said than done.
Absolutely.
How do we address these issues surrounding our gut problems? David?
Well, first of all, we've got back to some very basic things. We've got to keep our fibre intake up, 30 to 50 grams a day. We've got to keep our hydration up. We've got to keep minimal the intake of things like antibiotics and drugs and so on. And, also keeping to a nice balanced diet, avoiding things like preserved meats, some synthetic foods, all that sort of stuff. So I guess it's all dietary. And I think, another things we can also talk about is things like exercise and hydration and so on. And of course, my favourite one is probiotics. So I'm not going to leave that one alone because I think that has a huge influence.
Is it okay for your tummy to rumble a lot? I feel it's obviously impolite and it's embarrassing, but are our stomachs supposed to make noises and, talk to us?
Well, this is if you don't present with many symptoms, such as the bloating, the pain, the discomfort, the diarrhea, and all the rest of it, I think it's quite normal. But then there's another thing that we call aerophagia, which simply means that we swallow a lot of air because we're all talking too much and eating our foods too quickly. This is a big thing.
I've heard Joe talking to her tummy, so it's settled now.
That is so my problem. I talk so
the
fast.
phone in one hand, sandwich in the other sort of thing, and then people try to do something with another third hand that they don't have. And that's a huge one, and people often think that it's a bit of a joke, you're chewing food. It's the process of digestion starts in your mouth.
Yes.
Yeah. And if you bypass that 50% of it, it's all systems lost then.
So to wrap things up, really important to keep it simple, as you're saying. We've seen the rise and rise of over-prescription of antibiotics, haven't we? We had recently Antibiotics Awareness Week.
Yes.
We're addicted to them. We're one of the worst nations in the world.
Yes. Yep. So and a lot of medications, non-steroidal anti-inflammatories, the classic. Every second person takes a non-steroidal, and that irritates to blazes your gut lining.
Throws our important gut out of whack and keep the stress at bay as well. Thanks, Dr. Amy, for being with us.
Thank
Dr.
you.
David.
My pleasure.
Gerald as well. Really interesting big topic.
Yes, and I can't apologise enough.